Thank you for joining me. My name is Christina Kennedy. I am the Compliance Officer for Madison County, and today I will be providing you with training on the HIPAA privacy and security rules. Here at the county, we are committed to protecting the privacy of those we serve in our programs. For purposes of this training, I will refer to those we serve as patients. In this session, you will be introduced to the federal requirements that serve to protect a patient's rights to privacy and security of their personal and health information. You will learn how we use patient information and bill for our services. You'll be introduced to the procedures and practices that are in place to protect patient information entrusted to us, including the role of the privacy officer and security officer. We expect that you will fully understand your role and the responsibilities we entrust to you as an employee in protecting the privacy of those we provide services to. Our commitment to patient privacy. We take our responsibility to protect patient information very seriously. Historically, federal and state laws have existed to protect patient privacy and assure confidentiality related to healthcare and treatment. More recent federal legislation, the HIPAA privacy and security rules, afford patients even more rights and protections related to their personal health information. As a provider of a variety of healthcare services, we must comply with all applicable federal and state laws governing our operations, including patient privacy. We must protect any patient-related information from unauthorized access or release of any information that can be used to identify a patient. Our commitment to patient privacy and an explanation of how we use and disclose patient health information is explained in our Notice of Privacy Practices. We have designated personnel responsible for assuring patient privacy. The privacy officer and security officer are senior level employees charged with the overall responsibility for our compliance with patient privacy requirements and the security of all electronic patient information and systems. It is the privacy officer's responsibility to handle complaints about privacy and requests for patient information in compliance with the applicable privacy rules and requirements. However, assuring patient privacy is a shared responsibility of each and every employee. To safeguard patient information and carry out our commitment to our patients, we have established and put into practice well-defined policies and procedures. Each employee is responsible for adhering to our policies and procedures. We have systems in place to identify, investigate, and report breaches of patient information. Should a breach of patient-protected information occur, we will institute corrective actions which may take the form of a revision to procedures, additional training, and disciplinary action up to and including termination of an employee. HIPAA privacy and security requirements. The patient privacy rules and standards reference protected health information, or PHI, when addressing patient health information. It is important that you, as an employee, understand the definition of PHI. It is defined as any individually identifiable health information in any form or medium that relates to a person's healthcare or condition, that relates to the provision of healthcare, or that relates to the payment for healthcare. PHI is any demographic information that can identify a person, such as their name, initials, address, dates, telephone number, insurance or social security number, account number, photo, or email address. An easy way to define PHI is that it is any information that can be used as a link to a person's health information. And PHI can be in any form. It can be oral or verbal. It can be on paper or fax. It can be on a computer, laptop, smartphone, a network, or a portable device such as a USB drive. Some examples of documents commonly used in our programs and operations that contain PHI include paper, fax, and electronic records, intake and referrals, patient demographic information, case notes, treatment or service plans, service documentation, and billing information. HIPAA stands for the Health Insurance Portability and Accountability Act of 1996, and it introduced two significant rules addressing patient privacy and the security of electronic information. The federal legislation was developed to provide portability of health insurance coverage to people who change jobs. As sensitive information became more accessible and stored electronically in computers and the networks they were transmitted over, Concerns were raised about the security of information and the privacy rights of individuals. The HIPAA privacy and security standards were adopted to address these concerns. The HIPAA privacy rule became effective April 14, 2003. This rule addresses access to and uses and disclosures of protected health information. All PHI that we or any of our business associates possess or transmit in any form or medium, whether electronic, paper, or oral, is protected by the privacy rule. The HIPAA security rule became effective 2 years later on April 22, 2005. This rule requires a healthcare provider to establish physical and technical safeguards to protect the confidentiality, integrity, and availability of PHI. Providers must assure that health information is secure. As a healthcare provider, we must comply with the security rule and require the same of our business associates. In 2009, another federal law, commonly referred to as HITECH, was enacted to further protect the security of patient information. Part of the law, the breach notification rule, requires a healthcare provider and their business associates to provide notification to individuals, Center for Medicare and Medicaid Services, the Office of Civil Rights, and in some cases the Attorney General, when any breach or disclosure of unsecured health information occurs. You are probably familiar with some of the large businesses and agencies who had to notify their customers that their personal information was accessed, usually by an unauthorized access to the computer system. Similar requirements exist for healthcare providers and their business associates under the HITECH rules. If any unsecured or unencrypted information is accessed, used, acquired, or disclosed, the entity must notify the individuals, government authorities, and in many instances, the news media. Breaches of patient information can be detrimental to our patients, our employees, and our reputation. The HIPAA and HITECH rules are applicable to covered entities and their business associates. A covered entity is defined as any healthcare organization or plan who stores, possesses, or transmits health information electronically. In applying the HIPAA rule to our operations and our interactions with healthcare providers, we are considered a covered entity because we provide healthcare to patients. Physicians who order our services for their patients are considered covered entities under the HIPAA rules too. Other healthcare providers who refer patients to us are considered covered entities. And healthcare plans or insurers who possess and pay claims must comply with HIPAA rules as a covered entity because they transmit data electronically for purposes of billing. The HIPAA rule allows covered entities to share patient information between them in order to provide treatment or bill for services as long as the information is safeguarded. Many covered entities contract with other organizations for some of their business operations. These contracted vendors are considered business associates. The HIPAA rule defines a business associate as an organization who performs services for a covered entity that involve the use or disclosure of PHI on behalf of the covered entity. Some examples of business associates include billing or coding companies, IT consultants, a paper shredding company, a law office or accounting firm, electronic medical record or electronic health record company, such as Madison, or a third-party administrator assisting a health plan. The HITECH rules require business associates to safeguard all patient information provided to them as part of their business relationship and to promptly notify the county of any improper disclosures of patient information. We outline the safeguards in a business associate agreement with each one of our business associates. Madison County is a covered entity that qualifies for the hybrid entity status under HIPAA. This means we are a single legal entity that is a covered entity, whose business activities include both covered and non-covered functions, and that designates its healthcare components, i.e., any department that would meet the definition of a covered entity or business associate if it were a separate legal entity. This designation helps to ensure that the HIPAA rules apply only to our departments designated as healthcare components and business associates, and not the organization as a whole. The healthcare components must securely segregate PHI from access by or disclosure to non-healthcare components, and follow the procedures and policies in order to adhere to HIPAA's administrative, technical, and physical safeguard requirements. The HIPAA rules define uses and disclosures of patient information. A use is defined as the sharing or use of patient information within an organization that maintains it. The information is used for 3 allowed purposes: for treatment, for payment, and for internal operations. We use information internally to treat or provide services to patients and to evaluate the effectiveness of our services. A disclosure, on the other hand, is defined as the release, transfer, or provision of access to PHI outside of the entity holding the information. When we transmit claims information for payment, we are disclosing PHI. The HIPAA rules define allowable uses and disclosures as the sharing or release of information for purposes of treatment, payment, and operations, or where required by law. All other uses and disclosures require specific authorization by the patient. Penalties for non-compliance. The HIPAA rules include penalties for non-compliance. The federal fines for non-compliance are based on the level of perceived negligence found within your organization at the time of the HIPAA violation. These fines and consequences can range from $100 to $50,000 per violation or per record, with a maximum penalty of $1.5 million per year for each violation. An entity can be fined up to $25,000 per person per year for each unmet HIPAA privacy or security standard. An improper disclosure of patient health information can result in a $50,000 fine and 1 year in prison. More serious fines and penalties can be imposed for instances where health information is obtained under false pretenses or in cases where health information is used for personal gain. The Federal Department of Health and Human Services and Office of Civil Rights are charged with enforcement of the HIPAA rules. Audits of compliance with HIPAA privacy and security requirements have been conducted, and thousands of claims of HIPAA violations have been investigated. As of June 2020, OCR has settled or imposed a civil monetary penalty in 75 cases, resulting in a total dollar amount in excess of $116 million. Penalties for not meeting HIPAA standards can potentially cost an organization millions of dollars. The fines and penalties can be detrimental to an organization and have devastating effects on its patients. We take our responsibility to protect patient information very seriously and will take disciplinary action, including termination, against any employee who fails to follow our policies and procedures regarding patient information. Some recent and high-profile settlements demonstrate the severity of fines and penalties that can be imposed upon providers. In October 2019, the Jackson Health System received a civil monetary penalty of $2.15 million for violations of the security and breach notification rules that occurred between 2013 and 2016. The largest data breach reported to OCR in 2016 involved an employee inappropriately accessing and sometimes selling more than 24,000 patients' records. An OCR investigation found the health system had failed to provide timely breach notification to HHS and to appropriately restrict employees' access to patient data, among other issues. Those other 2 HIPAA violations involved a leak of patient health information to the media and a loss of paper records. In 2015, the OCR began an investigation after a reporter shared a photograph that included an operating room screen containing a patient's medical information on social media. As a result of the investigation, Jackson Health System determined that 2 employees had inappropriately accessed the patient's electronic medical record. In 2013, Jackson Health System reported to the OCR that its Health Information Management Department had lost paper records of 756 patients earlier that year. An internal investigation later revealed that an additional 3 boxes of patient records were lost in late 2012, but the health system didn't report the increase in affected patients until 2016. Jackson Health System's fine marks one of the OCR's largest settlements from 2019, and it highlights the importance of having proper policies and procedures in place. In July 2020, Lifespan Health System settled for $1.04 million after it reported a breach of 20,431 individuals' electronic protected health information, which included patients' names, medical record numbers, demographic information, and medicine information, as the result of theft of an affiliated hospital employee's laptop. Earlier in 2020, Premera Blue Cross was ordered to pay $6.85 million in fines for noncompliance with the HIPAA security rules, where cyber attackers gained access to its IT system through the use of a phishing email. The breach exposed the PHI of 10.4 million people. This resolution represents the second largest payment to resolve a HIPAA investigation in OCR history. And just in October 2020, Aetna, an American managed healthcare company, was ordered to pay $1 million in fines for their failure to follow HIPAA rules, which resulted in 3 breaches all within a 6-month period affecting 18,000 individuals. Breaches of this nature not only expose a provider to significant fines and penalties, but can be detrimental to the reputation of an organization. Just this past week, OCR announced its 11th settlement in its HIPAA Right of Access initiative for this year. The initiative was announced as an enforcement priority in 2019 to support individuals' right to timely access to their health records at a reasonable cost under the HIPAA privacy rule. Fines ranging in the amount of $3,500 up to $160,000 have been imposed upon various healthcare providers for this type of violation. OCR has made it clear that they will continue to prioritize HIPAA right of access cases for enforcement until providers get the message. How we use patient information. We use patient information or protected health information in conformance with the HIPAA rules for purposes of treatment, payment, and operation. In our provision of healthcare services, we use patient information for the purpose of treatment when we receive clinical information and orders from physicians and other healthcare providers for service provision. We use and transmit patient information between departments and to our billing vendor and insurers for purposes of obtaining payment for our services. And we use patient information to perform operational activities such as quality assurance, analysis, and monitoring of services. Under HIPAA, it is not necessary to obtain patient authorization to use or disclose patient information for the purpose of treatment, payment, and operations. The HIPAA privacy rule includes what's known as the minimum necessary rule. This rule requires an entity to take reasonable efforts to limit the use or disclosure of PHI to the minimum necessary amount needed to accomplish the intended purpose of the use of the information. We have established procedures and processes to limit access to PHI only to identified persons and only for specific purposes. Before releasing or using patient information, you must ask yourself, what information is needed for this release? In some instances, disclosing more than necessary may be a violation of HIPAA. A common example that violates the minimum necessary rule is when billing personnel are provided with the patient's clinical information. In order to bill for the service, billing personnel only need demographic information about the patient, the date of service, a diagnosis, and a procedure code. Providing full access to the clinical information or test result is a violation of HIPAA privacy rules, specifically the minimum necessary rule. It is important for you to understand that the minimum necessary rule does not apply to requests for treatment or services. Healthcare providers are able to share any and all information necessary to assure effective treatment and quality services. It is not the intent of HIPAA privacy rules to limit disclosures of health information to the patient. Providers must have practices in place that describe how information will be shared with the patients and their legal authorized representatives. Additionally, the minimum necessary rule does not apply when a patient authorizes the release or disclosure of information. In most instances, the patient will sign a written authorization that specifies the amount and types of information to be released. And when the disclosure of patient information is required by law or for purposes of public safety, the minimum necessary rule does not apply. We do not expect you to be a HIPAA privacy or security expert, but we expect that you adhere to our policies and procedures or seek guidance from the privacy officer, security officer, or compliance personnel if you have a question are unsure of our practices, or are faced with an unusual situation. The HIPAA privacy rule provides specific rights to every individual. Specifically, individuals have the right to see or inspect their clinical record and obtain copies of the record. If denied access or copies, the individual is afforded the right to request a review of denial. They are also allowed to change or amend information they believe to be incorrect, be provided with a list of disclosures for the past 6 years, restrict uses and disclosures of their information, request the provider communicate in ways to protect their privacy, and receive a paper copy of the Notice of Privacy Practices. We address each of these rights in our Notice of Privacy Practices. The notice is provided to each patient and should be readily available to interested parties. We have also developed policies and procedures to address each of these rights. The provider has several responsibilities under HIPAA. Specifically, we must assign responsibility for privacy and security, establish procedures for handling PHI, provide physical security of records and patient information, provide technical security of our networks, computers, and other electronic records, establish rules for protecting patient privacy, allow patients access to their medical records, respond to complaints, publish a Notice of Privacy Practices, ensure that our business associates protect patient privacy, and train our employees. To assure we fulfill our responsibilities, we appointed a privacy officer and security officer, established policies and procedures to address each of these responsibilities, and provide guidance for all employees. It is important that you are familiar with the policies and procedures and comply with them. We must provide all of our patients with a Notice of Privacy Practices that describes how we will use their personal and health information. Our Notice of Privacy Practices informs our patients how to use their health information, how their health information will be used to provide and bill for services, how we use and disclose their health information, and about their right to access and amend their medical information. The notice also describes our responsibilities with respect to their protected health information and provides information on how to ask a question or file a complaint. How we protect patient information. We have invested considerable time and resources to fulfill our responsibility under HIPAA regulations and our commitment to protect the privacy rights of our patients. Specifically, we notify patients how we will use and disclose their information through communication of our written Notice of Privacy Practices. We provide training to our workforce. Policies and procedures are in place to provide guidance to employees. We have instituted both physical and technical safeguards to limit access to both paper and electronic records. We limit access to patient information to that which is necessary for an employee to perform his or her job. We have business associate agreements in place with those entities who have access to protected health information in the course of doing business with us. And through our compliance program, we monitor for compliance with laws, regulations, and our own procedures governing protected health information. We are committed to investigate and report, if necessary, actual or potential breaches of information. When we identify a weakness in our system or procedures, or have an instance of noncompliance with laws, regulations, and our procedures, we promptly implement corrective actions that may include a revision to procedures, retraining, and disciplinary action if warranted. The privacy officer, security officer, and compliance officer are all available to provide oversight and guidance to employees, patients, and other providers and payers as we continue our efforts to safeguard patient information. Any unauthorized or improper use of protected health information must be promptly reported to the privacy officer. This includes both accidental and intentional access, use, or disclosure of information. Improper or unauthorized use or disclosure typically occurs when procedures are not followed or as a result of carelessness. If an employee accesses the records of a friend or family member for reasons that are not job-related, the unauthorized access results in a HIPAA violation. Sharing of passwords, a prohibited activity, can result in unauthorized access or use of protected health information. Again, this is a HIPAA violation. Sending patient information to the wrong patient is an improper disclosure of protected health information, also a HIPAA violation. All improper uses and disclosures of protected health information must be tracked and in some cases reported. The privacy officer must assure a thorough investigation is conducted and corrective actions are promptly initiated. It is important that you safeguard patient information, access only that information required to carry out your job responsibilities, and comply with the procedures and the safeguards we have put in place. Here's a quick video that will give you a look at a few common privacy errors. See if you can't spot them before the video walks us through them.
Mrs. Jenkins? Okay, so let's get the ultrasound on that kidney scheduled. Tuesday afternoon work? Nothing Monday, huh? Well, I don't think so. Let me look.
Hey, when does your plane land?
Crack of dawn.
Is this your copy?
I don't know. What is it?
Looks like Nate Turner's MRI report.
Yep, that's mine.
So that is Monday morning, 9:45. Oh, thank you so much. You're welcome. Oh, right there.
Thank you, thank you.
Uh-huh.
See you Monday.
Okay.
I'm pretty sure you don't want to mail Mr. Richardson's blood work results. Am I right?
Oh, yikes. You are correct, sir. Thanks. Have a good weekend.
You too.
Oh, hey, Jerry. Wait. I forgot one.
Did you see them all? Let's look again.
Okay, so let's get the ultrasound on that kidney scheduled. Tuesday afternoon work?
When talking with someone about PHI, make sure that you can speak privately and keep your voice down so that others don't eavesdrop or accidentally overhear you.
Is this your copy?
I don't know. What is it?
Looks like Nate Turner's MRI report.
Yep, that's mine. All copied PHI should be taken with you and secured. Or, if it's not needed, it should be shredded and disposed of in a locked trash container. This hard copy PHI should be put where it's not visible to everyone in the office, and care should be taken so that it isn't inappropriately misplaced or disclosed. This monitor should be repositioned, or the screen should be locked so that PHI isn't visible to anyone who walks by. With practice and a little work, you can easily learn to spot and avoid these kinds of privacy rule mistakes.
In addition to safeguarding against improper uses and disclosures of PHI, we are responsible for preventing breaches of patient information. A breach is defined as any unauthorized acquisition, access, use, or disclosure of unsecured or unencrypted protected health information. A breach occurs any time an unauthorized party, even those within our workplace, gains unapproved access to paper or electronic protected health information. Some common examples of breaches include a lost or stolen laptop or mobile device that could contain patient information. Discarding documents containing patient information in the trash can also result in a breach of information. A breach can also occur when unencrypted PHI is emailed outside of our network. Using your personal email account for work-related purposes poses significant risk for a breach of information and can result in disciplinary action to an employee. It is important that you report any actual or potential breach immediately to the privacy officer, the security officer, or your supervisor so that we can promptly act to mitigate risks and notify patients and government agencies. If the breach involves more than 10 patients, where limited or no reliable data can be found to contact them, we have to notify the news media and place conspicuous notices on our web pages in an attempt to notify the patients of the breach. HIPAA and PHI are sensitive health information that should consistently be encrypted and kept safe and out of the wrong hands. Here's another quick video that shows you several breaches of HIPAA and PHI rules.
pub?
I can't, I'm sorry. I have to pick up my sister. Oral surgery, can't drive.
Ouch.
Upside, she can't talk.
Oh, you're so mean. Hey, so I'm almost finished categorizing the patient records. Did you finish the medical file cleanup?
Not quite. Gonna finish up at home.
Yeah, I think I'll do the same. Right after I stop at the pub.
Shoot, I know, I'm so sorry. I got the notice and then totally forgot to do it. I'm writing myself a note right now. Change your password. Consider it done.
I'm sorry, but 9:45 just isn't gonna work. I'll be right there. Sending an email on the Schneider claim. Yes. I'm sorry, which pharmacy? Got it. Please hold. What can I do for you?
Did you see them all this time? Let's look again.
Did you finish the medical file cleanup?
Not quite. Gonna finish up at home.
If this laptop contains PHI, it's better left in the office. If you must take it home or out, be sure to encrypt the PHI before you leave the office.
Yeah, I think I'll do the same. Right after I stop at the pub.
Downloading PHI onto a thumb drive is another red flag. If you must, take extra care to make sure it's not lost or stolen. And again, encrypt any PHI that's on it. The same is true of any personal tablets and smartphones. If your organization does not have a BYOD policy, you should still make sure your personal devices are encrypted and that you can wipe them remotely if they're lost or stolen.
Change your password.
Following procedures like periodically changing your passwords can be a critical part of securing PHI.
I'll be right there. Sending an email on the Schneider claim.
It's best not to send PHI via email unless it's either encrypted or password protected. These small changes in the way you do work may seem like no big deal, but they can make an enormous difference. For example, imagine trying to explain to your boss that the company is facing a huge HIPAA investigation because you forgot to encrypt data on a thumb drive and then lost it on the way home. This could end up costing your employer millions in fines and penalties alone.
Together, we will assure patient privacy and the security of information. To accomplish this, we expect everyone to comply with the 5 basic requirements. Number 1, always safeguard patient information in any form, oral, written, or electronic. Number 2, follow the minimum necessary rule. Ask yourself if the information is necessary for your job. Number 3, refer all complaints and patient requests immediately to the privacy officer or compliance officer. Number 4, report any actual or potential violations of policies and procedures and practices promptly to the privacy officer, security officer, or compliance officer. And number 5, it is important that you are familiar with and adhere to our HIPAA policies and procedures. If you have any questions about our policies and procedures or practices, you should direct them to the privacy officer, security officer, or compliance officer. And remember, if in doubt, ask or report it. Additionally, HIPAA privacy and security information can be obtained by contacting our privacy officer, security officer, or compliance officer. I've included everyone's contact information on this slide. You can also visit the Health and Human Services website, which includes additional information and frequently asked questions. Remember, we do not expect you to be a HIPAA expert. We expect you to comply with the policies and procedures we have established and ask questions or seek guidance